The eye care experts at Harvard Eye Associates have been treating the vision of patients in Southern California for over 30 years. As a leader in multi-specialty eye care, our doctors specialize in cataracts, glaucoma, retina, cornea, LASIK vision correction, oculoplastics, and diabetic eye care. As an approved FDA research center, our doctors offer surgical techniques and technology not available to the general public. Harvard Eye Associates, the future of vision today. Laguna Hills, San Clemente. Call 800-974-EYES.
And welcome back. Dr. John Hovanesian is here today, Harvard Eye Associates. Nice to see you.
Great to see you too.
And I had mentioned you didn't bring along any slides today, but you did have a subject you wanted to talk about, and this is how we deliver medicines into the eye for obviously eye care. And everyone, I think, I don't know anyone who enjoys putting in eye drops, even if it's the kind of eye drops used to soothe your eye or for pink eye or something like that. You know, you got to do it, but there are other ways as well, right?
Oh, absolutely right. Ken, this is a big problem for a lot of people. There's no patient of mine who likes to take eye drops. It's just an unpleasant chore to do. And we often miss. We put half of it on our cheek or the forehead.
Yeah.
There's 2 or 3 drops that we use for every one that gets to where it's supposed to. And we have to do it frequently for the medicines to get in the eye. And another problem we see nowadays with some of our good but older medications is that they've become generic. And that's good because it can reduce cost. It doesn't always. But those generic medications are very different formulations, even though they're the same medicine. And so the eye may suffer side effects from generic forms of eye drops that cause blurring of vision and irritation of the eye and allergy to develop. And so we're very cognizant of that. And then, of course, there's the whole factor with forgetting to take our drops. If you've got a need to take it more than once a day, and even once a day, it can be very difficult. So there's a whole science built now around looking at new ways to get medicine into the eye. And if you think about it, the best way to take a medicine is to have it delivered to part of the body slowly over time. So the right amount of medicine is there when you need it, and that it's not there when you don't need it. If it's slowly over time, you're less likely to have side effects as well.
Yeah, exactly.
So we've, for people with macular degeneration, which is an awful lot of folks here in the village, many of them who have the wet form of the disease receive injections in the eye, and they're not nearly as painful as it sounds, not as scary as it sounds, on a monthly basis.
Oh, yeah.
And,
that does sound a little intimidating.
Well, there's no part of it that's pleasant, let's face it. But the new trend with these medicines is to move toward those that are less frequent use of medication, or even implants that can go in the eye that will give the medicine slowly over time. The reason it's done monthly is not because you want the dose all at that time. You want it slowly delivered over the month. But we give it once a month and the medicine stays around. So the more we can stretch that time out, the more we do that. And devices that do just that are coming through the process of clinical trials, which means we're probably within a couple of years seeing approval. We're using in our practice now doing a study on a new way to give medicine to the front of the eye. So macular degeneration is in the back of the eye. We work a lot in the front of the eye when we do, say, cataract surgery. And we've got a device that is in clinical trials that gives the medicine that we need for 1 month after surgery in the form of a tear plug. Now, we've talked before about tear plugs. They're tiny devices, we've had them for years, that go in the tiny duct in the lower eyelid. And these devices, they don't hurt, we don't see them, we don't feel them. And what they do for people with dry eye is help their eyes to retain more natural tears. In the medication delivery way, these types of plugs themselves melt away slowly over about a month time, or it could be longer if we wanted. And they give during that month the medicine to the eye. So it's right there next to where the tears flow around the eye.
Do you even see it if somebody's looking at you?
Can't see it.
Okay.
We can look with a special light and make sure that it's still there.
Right.
Because, gosh, you'd worry if it went away somewhere, how would I know? But so we can verify if we need to, and actually almost anybody can with the right color light. They can look and pull down the eyelid and see a tiny little bit of a glow where the device is, but otherwise you can't see it. And what it does is give this medicine. And what we're finding in this study, which is fascinating to us, is that people who have this type of method of giving the medicine to the eye do very well. In fact, they do better because we have a slow release of the medication. Isn't that interesting?
Yeah, that really is. And could this be used eventually for macular degeneration, even though that's on the back of the eye, so someone doesn't need an injection?
Absolutely. Those kinds of possibilities are certainly coming around. It has to do, just like any other chemistry, with how much of the medicine gets to the place it needs to get. And so we may do better with medicines delivered into the back of the eye, which would mean some type of injection. But if we can get a medicine that's potent enough that it will pass through the eye tissues and get to the back of the eye in sufficient concentration to do what it needs to do, then you bet, if we can do it less invasively by putting something in the tear duct, then that's certainly the best way to do it.
This sounds a little like the benefit that people who are diabetic, instead of taking the injections, they have the automatic insulin pump on the side that may give a little sound or a little cue that you need to adjust it, but they don't need to take those injections every day or whatever it is.
That's a perfect analogy, because with an insulin pump, what you have is the ability to monitor the blood sugar at any time in real time, and then to deliver short-acting insulin to the body through a tiny little needle that those devices use into the tissues. And so we have found with diabetic patients with insulin pumps that we can achieve a much better, tighter control of blood sugar than with any other technology that's available. And this is not a feedback mechanism where we're giving eye drops. We know about the right amount of medicine to give, and so it's just a matter of delivering it in that way. And the implications for people who take long-term medicines, like glaucoma medicines, where they're putting in drops in the eye sometimes 2, 3, even 4 times a day, to avoid that, to help them to do a consistent job of it, to maybe come into the doctor every 4 to 6 months and receive a little plug. It's a painless procedure that just takes a minute, is a far better way than interrupting our day with drops.
Yeah, that is wonderful. What about the over-the-counter type things when someone has a mild case of pink eye or just eye irritation? You have a lot of different ones on the market. You can go to anywhere, Walgreens, Target, whatever, and you have all these different brands. And sometimes it's a little confusing what I should be taking.
Sure.
If you're confused, all those places have a pharmacist. If they're open, certain times they aren't.
Right.
You can go to them and say, hey, can you recommend something?
Sure.
But are there certain ones that should be avoided, or are there ones that are easier on the eye?
That's a great question, especially for this time of year when the eyes are, when everybody's eyes are a little irritated here in Southern California. And by the way, just to sort of finish on that subject, there are devices for giving lubrication to the eye long term that can be placed in the lower eyelid. It's a device called a Lacrocert. And a lot of patients with dry eye don't know about them. We've got a wonderful dry eye specialist in our office, Karen Scavarna is her name, who uses them and has had good success with her patients. But you're right, for a lot of us, we're having a day where we're out there and it's windy and it's dry, or maybe the dust and the pollen is blowing in from the desert and our eyes are irritated, and we don't know. You go to the pharmacy and there's a whole aisle of hundreds, it seems, of different drops. There's different categories. Think by category and then you're going to do best. So there's the category of lubricant eye drops. Now, how do you know what category it is when you pick up a medicine? You'll read the label and it'll say Refresh Ultra Tears or something, and then below that it'll say the category. It'll say lubricant eye drops. And they're required by law to have that labeling right below the name. So lubricant eye drop is just what it sounds like. There's no medicine there, just purely for lubrication. In fact, that's the first place to go. We recommend it. You're never going to hurt yourself, even if you've had eye surgery, putting a lubricant drop in your eye. If you've had recent surgery, it's a good idea to take a fresh, unopened bottle so that you know that the contents are sterile, but you can put those in your eye. And that's a good place to start. And the other thing to start with, if your eyes are irritated, is either a warm compress, a washcloth that's warm, not hot, just warm, or cold. And if your eyes itch more, usually cold is better. Cold is better for allergies. If they're feeling burning and tired and dry, warm is usually better. but you're not going to harm yourself with a cold compress if you use it on a dry eye. You're not going to harm yourself the other way around either.
Okay.
Try what works and what feels good. The drops we recommend avoiding are those that say redness reliever. A redness reliever is a medicine that is medicine, and it's like a Visine, what we call a vasoconstrictor. It causes vessels to get small. It's a great idea in concept. And for short-term use, if you're going to be photographed or you're in a wedding, it's fine to do that. But the problem with using those drops regularly is that they cause the eye to become more red later on. When the drop wears off, it's more red, so what do? You take more redness reliever. And then you go through this vicious cycle of taking more medicine and getting less relief. And before long, the best thing you can do is just get off the drops. Don't use them at all. So
all right.
That's our general advice on what to do when your eyes are irritated.
And of course, this time of the year, we talk about just eye protection and the proper sunglasses. If you're working outside, I was doing some work in my yard the other day. You know, I've got the eye protection on, and we've talked about this before. Even you're out there trimming, especially rose bushes or something like that.
Oh, yeah.
You know, wear something, because you don't often see that one thorn coming up like that.
From the side. It's typically when you're leaning over, going down, and something that you didn't notice just pokes the eye. And some of those injuries can be very, very damaging.
Yeah, so you've got to protect yourself all the way around.
Good thinking.
And,
wear your sunglasses, wear your safety glasses.
Exactly. You've always said the sunglasses that are a little bit more wraparound are better, so you don't get stuff coming in from
and it's also good for side protection from the sun, because you know, some of the stylish, now the current glasses that are popular have the wraparound curved design, but the older ones that are the flat, sort of the Ray-Ban Wayfarer style, are not quite as good for sun protection as the newer styles.
All right, very good. Well, it's nice to have you on. Good advice.
Thanks.
And
great to be here.
As I said at the top of the show today, that we're going to come over there and do a few segments there coming up in a few weeks. And then once they're done, we'll bring them to you. All right.
Thanks very much.
All right, good to see you again.
Nice to see you too.
All right, we'll be back in just a moment.
Harvard Hearing Center is now offering the world's first 100% custom, invisible, and fully programmable digital hearing aid. These amazing devices are designed to be comfortable, provide a more natural sound, improve hearing in noisy environments, and are completely invisible. These hearing aids fit right into an active lifestyle, improving your quality of life without interfering with your activities or your looks. Call Harvard Hearing Center today to schedule your complimentary hearing screening. 949-900-5239.